Mhm. Good afternoon, good evening, and good morning, depending on where you are in the world. We are happy to have you join us in this very important webinar, which is in celebration of World Health Day, and we have seen a high number of registrations for this webinar, one of the highest in IMPHNET. And so far we have around 1,020 people registered. And now I want to hand over the floor to the Executive Director of IMPHNET, Dr. Mohanna Dansour, and the Senior Public Health Specialist of IMPHNET, Dr. Nada Ahmed, to facilitate the session.
Okay, thank you very much, Dana. Uh, good morning, good evening, good afternoon, good everyone. Eid Mubarak. Wishing a blessed year ahead. So hope you enjoyed your holidays as well. So again, this is one of the infinite regular webinars, but it's growing and evolving over the last 3 years. And it's the idea is evolving in a way it's became more than just a seminar webinar as we are doing today. It's a state of public health, challenges, and we start talking more specific about more very specific and important topics to the region. And we are on behalf of Infinite. I really warm welcome to you to this important webinar, which comes at a very challenging time, as our region faces numerous health difficulties brought about by political conflicts, as we know, and climate change, other challenges, war, conflicts. Our health systems are under increased strain, gravity, and shortage of health workforce, and our health systems are under really burden of non-communicable disease and long-standing health issues that have developed over many years, not slowly due to the current event. Today, and in face of these challenges, we must ask ourselves, how can we shift from reactive, responsive to proactive? Context-driven strategies. Today's webinar will explore findings from the report, naming, the state of public health in Eastern Mediterranean region, and mainly focusing on Arab world and our challenges and opportunities as well. Co-authored by 4 distinguished and more, 5 colleagues, public health leaders in our region that we are proud of. And allow me to introduce our panelists for today, or speakers for today, or for distinguished guests, starting from our senior colleague, Professor Dr. Maher Ribat. I am sure many of us knows Dr. Maher. And Dr. Maher Ribat is the Egyptian former Minister of Health and Population. She was one of the World Organization Director General Special Envoys of COVID-19 and is a professor of public health at Cairo University and a member of African Commission of Africa COVID-19 Response Strategy. Within over 35, Dr. Allow me to say 35 years experience, Dr. Ribat has held multiple high-level political, academical, and leadership positions. She has worked closely with national, regional, international organizations as a public health expert on a wide range of public health matters and issues. She has particular experience working on health policies, system strengthening, and reform, particularly in lower and middle income countries in fragile settings and among vulnerable groups for a progressive realization of health equity and universal health coverage. So thank you, Dr. Maha, and it's our great pleasure to have you with us today. I do not see the second. I should introduce Dr. Salman. Does Dr. Salman is with us today? Maybe he's coming late. Then we can move to Professor Dr. Hiba Al-Khati also. Professor of Geriatric Health and Dean of the High Institute of Public Health, Alexandria University. And I think when it comes to the public health in Arab world, we cannot forget the service and the advance of public health and from this institute. Many of our senior colleagues and
Yes.
even leaders, professors are graduates from Alexandria. So we
Professor Salman himself.
Okay, good.
One of
So
our great graduates indeed.
we have really it was the real Institute for Public Health and so more than decades of that. So Professor Qadi is the distinguished public health researcher and academic whose work has significantly advanced of understanding of aging, health behavior, and socio-economic determinants of health in Egypt and broader Eastern Mediterranean region and as an Arab world. With a career spanning over 2 decades, Dr. Al-Qadi has contributed to critical areas in public health, particularly geriatric health, mental wellness, and social determinants of disease that we are really need in our region a lot. So thank you very much for being with us, Dr. Qadi, today.
Thank you. Thank you. My honor, Prof. My honor.
And it's a pleasure also to have the Alexandria University with us presenting.
Thank you.
This is another issue. Moving now to our friend, Professor Abdul Latif Husseini. And Professor Abdul Latif, in addition, you know, our friendship. He is a professor of public health, former director of Institute of Community and Public Health, and the master of Community and Public Health program in Birzeit University, Palestine. His research interests are rooted in improving the health of the population by identifying the various determinants of health and targeting modifiable risk factors through evidence-based interventions. Although his research focus has been on non-communicable diseases and their risk factors, especially diabetes mellitus, cardiovascular diseases, and their risk factors, especially diabetes mellitus, cardiovascular cancer and palliative care, obesity, smoking. He works occasionally on important communicable diseases, including brucellosis and hepatitis. His work spans across epidemiology, public health practice, program evaluation, and capacity building in public health. He is a co-founder of the Master Public Health program at Birzeit University and the main founder of the Master Public Health program in Qatar University. Professor Husseini has authorized 60 scientific articles, book chapters, and other scientific reports. And we really honored to have a Professor Abdul Latif and for his in person also to have Palestine with us during this time.
All the honor is mine to have you and to have all these great colleagues with us. Thank you very much, sir.
Thank you. And finally, very good friend, and I have to admit to all colleagues, I am not that Professor Faris advised me to correct my tie, and I look very nice now. This is the privilege of Professor Faris. So thank you very much, Dr. Faris, for taking care of me on this matter. So Professor Faris is a professor and head of Community and Family Medicine Department at the College of Medicine, University of Baghdad. He is distinguished public health expert with extensive experience in epidemiology and health systems strengthening. In addition to his academic role, he serves as a chair of Scientific Council of International Academy of Public Health, AYAF, where his contribution to advancing public health education and research in the region. Dr. Lamy had played a key role in capacity building efforts for public health professionals, particularly in Arab world and Eastern Mediterranean region in general, and has collaborated with numerous international and regional institutes in strengthening applied and field epidemiology training and surveillance system. His work bridges academia, field practice, and policy, making him a respected figure in global public health circles. So once again, thank you all. Thank you for panelists and guests, and thank you for all colleagues who are attending these webinars. And really, it shows how much the region, public health people in the region are eager to hear more about the status of public health and how we can be more proactive, not just to keep mentioning. So far, if we look at the chat, I think we have more than hundreds of comments and etc. So this is maybe, I can tell, one of the most interactive and the most, attractive, and encourage colleagues, to be part of it. So what we are going to do within the time, which is 1.5 of an hour. So our structures include 2 key sessions. The first session will address pressing health challenges facing our region, focusing on public and Arab world, grounded in the report's insights. And the second session will explore how adopting context-specific strategies proves beneficial to tackle these very issues. We will also hear your voices during Q&A. We hope today's dialogue generates clear recommendations for actions for defense collaboration and greater innovation, especially in resource-limited and crisis-affected settings. Let us, if you allow me, let us now begin with a short introductory movie or video featuring the report's key highlights. The movie is it's not long, it's 2 minutes and half minute. So the movie, please.
In 2024, the Eastern Mediterranean faced unprecedented health crises driven by conflict and climate change. Sudan, Gaza, Syria, Lebanon, and Yemen were among the hardest hit with humanitarian crises. In response to these crises, official relief efforts intensified despite overwhelming financial and logistical challenges, with the lives and safety of many at stake. In the region, the growing threat of climate change is worsening an already fragile situation. Without clear adaptation strategies, the response cannot keep up with health events resulting from accelerated natural disasters. Antimicrobial resistance, AMR, is rising rapidly in the region, posing an increasing threat to global health. Non-communicable diseases represent a growing health crisis across the region. Health systems in the region remain underfunded, and when resources are allocated, they often focus more on curative care rather than addressing strategic preventive needs. The region is also facing a healthcare workforce crisis, with a growing brain drain as skilled professionals leave due to low wages and poor working conditions. The region faces 3 major health challenges: rising substance use, particularly opioids, a loss of 3.5 million life years annually due to road accidents and conflicts, and the urgent need for improved occupational health policies. Despite these significant challenges, there have been notable achievements in the region. Regional solidarity emerged in response to the immense health challenges facing the region, a crucial necessity in these times. Countries of the Gulf region are making significant strides in using AI and technology in healthcare. From digital health platforms to robotic surgeries and cutting-edge data analytics, the region is embracing innovation to improve medical services and boost patient outcomes. The unprecedented crises of 2024 have highlighted the urgency for action. To overcome these challenges, we must first understand the issues, then prioritize them, and finally collaborate both nationally and regionally to strengthen health systems where they are most needed.
Thank you very much, colleagues. And I see now Professor Salman Rawaf. Professor Salman, how are you today? Thank you for joining.
Hello, Mazen, I'm fine. Thank you very much.
Good.
I'm sorry, I have a
Excellent.
technical problem.
No problem
My
at all.
apologies.
So maybe I have to go back and introduce quickly Professor Salman, although I know that many of us know Professor Salman, and we just knew today that you are Alexandria University graduate, so congratulations. This is very prestigious place to be graduates from. So, Professor Salman, in brief, Professor Salman Rawab qualified in medicine with a training in pediatrics and public health. Professor Rawab is director of WHO Collaborating Center of Public Health Education and Training, and well known for his international work and contribution to the global health. He is advisor to the World Health Organization on primary health care, public health, health system, medical education, and the human resources for health development. He is also recognized for his work supporting countries and particularly the Arab countries and Eastern Mediterranean in general to strengthen their health system and service development, including, I have a very long list, but I will be trying, short, Bahrain, Iran, Saudi Arabia, Kuwait, Libya, Oman, Iraq, Palestine, Qatar, Yemen, and many other from other region as well. So welcome, Professor Salman, and we started with the movie, and we can now begin with our first session of today, a special events. So the report, colleagues, outlines intersecting crisis, growing substance abuse, health worker migration, climate related threats, and fragile health system and complex zone. But within these crises lie opportunities, as we said, and we need to learn how to be proactive rather than just reactive, and how we can better act in our region, especially, and I do not want to be more political, but especially we are seeing other regions, they are moving faster than what we are doing in our region. Colleagues, this report took us 6 months, day and night, working on, because we made sure every single number, every single reference is very validated, and it's very and it's we cross matching different resources, and I think this first time, at least to me, to see, I know that we have many of documents, especially from WHO, produce excellent documents, but this time we are talking more about how we can targeting, gathering all these Arab problems and challenges that we are facing, and could be in the one of the recommendations later on to have such similar reports with improvement. This is the first attempt, and we are moving forward with this. So now I will direct target question to each of your panelists, if you allow me, drawing one sections in the report. Panelists will have 5. Please, I know that this is short, but allow me to be, as you know me, I am not harsh person. I am not a strict person, but I have to be strict with the time this time because they are pushing me behind, please, to control over the time. So my apology before starting, okay? So now panelists will have 5 minutes to respond to you. Professor Dr. Maha, starting with the Professor Dr. Maha, and we understand that the Arab world and Eastern Mediterranean region in general is facing complex and proactive humanitarian crisis. And that the overall strain on health system is huge. But within this broader picture, there are unique and pressing vulnerabilities, especially among women and children. How can we move beyond general emergency response to ensure that these groups receive focus? These groups, I mean women and children, receive focus, sustained attention, both in terms of immediate care and longer term protection and resilience. Professor Ma, the floor is yours. 5 minutes. I know it's not enough, but we will try to make.
No, we'll do my best. We'll do my best. Thank you very much.
The question to Dr. Maha, if you please.
Dr.
Yeah,
Salman,
sorry,
please
sorry.
go on. I know. If you want.
No, we have the second question
I
for
have
him.
problem with the connection, as I said, so I'm sorry. Carry on.
No problem at all. Professor Maha, for sure.
Well,
Please,
thank you very
Professor.
much, and thank you very much, and good afternoon, everyone. Actually, before starting on the humanitarian, I would like to just pinpoint the fact that the countries are diverse groups of countries. The contexts are different, situations are different, and even the exposures are different in a way, and the response and the fragility and the health systems are different. So when we're talking about the vulnerabilities, particularly in humanitarian settings, and it depends on the causes or the context of the humanitarian settings, whether it's from the climate change, whether it's from fragility due to political issues, wars, and the thing here that we need to be thinking about is what is this context? When we are talking about the vulnerabilities, and definitely we know that women and children are mostly affected, and the elderly, of course, are mostly affected. And to address their urgent needs, and as you have mentioned them all, the malnutrition, sexually transmitted diseases, the abuse, whatever we can think about, the climate change weathers, and all of this, we need to be talking about the urgent or the emergency needs and the long-lasting and resilient needs, if we're talking about it. And here, before starting on these things, I would like to mention that we need to be thinking as well of the governance structure or the governing structure that would really support people and the vulnerabilities in the humanitarian settings. Where, who, and what are they doing? What are the policies that are governing their health, the universal health coverage, their emergency, and the resilience that is built, and even the policies and the regulations that are there? Who should be thinking about it? Is it only one country's approach, or is this should be a collective issue that we need to be thinking about, or a collective platform? So when we're talking about the things that, or the issues that we need to be responding to, we need to think of the urgent needs in humanitarian contexts, while building on the longer term resilience in the fragile settings. And we need to be thinking about the emergency response. Do we have life-saving assistance? Who's providing the food and water, the shelter, the health care and the coverage? We say leaving no one behind. Who should be providing the health care? And what type of health care is really needed? apart from the emergency medical assistance, but we need to be talking about the mental health, the vaccination, addressing disease outbreaks, the protection services, as well, as we said, because it's not only about disease and needs and food and shelter, it's about how we're protecting them and the rights, and especially for women and children and the elderly. And how can we ensure in emergency settings the accessibility and the coordination which is truly needed during the acute phases as we're talking about. So the coordination, we have to have the coordination mechanisms, the cluster systems that should be there. We need to have agencies that avoid the duplication, to cover the gaps, the inefficiencies, and as well the communication. How are we ensuring effective communication, information sharing, experience sharing, feedback mechanisms, and from there we move to building longer-term resilience, which is the post-crisis, the development phase, and here we have to be very sensitive that we have the pull and push factors, but as well we have limited resources in many of the receiving countries. So we have limited stretched resources, but at the same time we have the policies and the regulations that we should be looking at. So we need, for the longer term, to strengthen the local capacities. Do we have local governance? Are we working with the local governance, the institutions, to improve their capacity? And the capacity building issue, we have to invest in the skills, training of local populations, agencies, the acceptance of the different contexts, the cultures, the education, the healthcare. And at the same time, there should be issues or factors that really support the promotion of economic recovery and livelihoods. So we have livelihood programs that have to be developed and established for job creation, small-scale businesses, economic recovery, agriculture and natural resource management, and social cohesion and peace building is really very important. We have different contexts and we need to have this cohesion and the conflict resolutions and community-led solutions that we're talking about. What is really important is that we need to tackle and to have a disaster risk reduction strategy, preparedness plan, infrastructure resilience, inclusive development. We have to know what is happening, why is it happening, how we are prioritizing, and the gender and social inclusion is very important. And in a way, there should be some sort of policies, regulations, you can name them all, where we have long-term financing, sustainable financing mechanisms, and partnerships, coordinated, strong, effective partnerships, sustained partnerships to respond to the emerging needs and to respond to the follow-up and post-conflict needs. And so we have to combine the immediate response with the longer-term resilience for early recovery, adaptive programs, monitoring and evaluation. And here I would like to just mention that the League of Arab States, they have a very well-developed public health strategy in conflict situations or in humanitarian situations. I think we need to refer to, because we need this, as we said, the governing structures to support what is really needed. So thank you very much. I'll stop here.
Thank you. Thank you very much. And thank you for being on time. Thank you very much, Dr.
I'm trying. You're not giving me a chance.
Perfect.
Doctor.
Perfect. Thank you. Thank you very much. And thank you very for rich information that you shared. And I think, yes, instead of keeping just a quick feedback, instead of keeping producing new strategies, documents that nobody on the shelves, and we need to revise and to do exercise and to revise what we have, what had been done. And from there we can start and we can move forward. This is a very important conclusion and a very important message from Dr. Maha, that we need, in addition to what she said from technical point of view, but I think number two is building on what had been done and not to reinvent the wheel and start from the scratch, as we unfortunately many times we are doing that. Now moving to our friend and our senior colleague, Dr. Salman. Dr. Salman, so while humanitarian crises continue to expose deep we talked about women and children, but we are also seeing how climate change is compounding these risks and placing further strain on elderly fragile system. As climate impacts escalate across the region, what do you see the most urgent gap in current adaptation strategies, if we have any? And what forms of cross-sectorial cooperation, if any, again, are essential to truly embed resilience into public health system? And allow me here to add from my side, a few years ago, Professor Salman and colleagues, we thought that the climate change it's not our business in Arab work. We thought that this is for developed work, and took us years and years to better understand that is coming to ours. So we start seeing droughts, we start seeing air pollution, we start seeing different new diseases are moving. The epidemiological map for for different diseases. We start seeing dengue fever in different new countries. We start seeing changing in different ways. So we are affected by the climate changes, and we cannot keep saying that this is developed world work. We are in, and we are in very bad shape in terms of climate change. Please, Professor Salman. You are muted, Professor Salman. You are muted.
My apologies.
Okay.
Thank
Excellent.
you very, very much. It's a very, very challenging questions. I think without being critical, we have major issues with the climate and climate changes and environmental issues and environmental health within the Arab region. I cannot exclude any countries, even within the rich countries of the GCC. So I don't want to be specific to any country. I may have the freedom to mention Iraq because I'm in Baghdad, and yesterday I was walking on the bank of the beauty of the river Tigris, and I recorded actually in photographs the unbelievable neglect to the environment. It's really shocked me, and shouldn't, but put some tears in my eyes to see that level of neglect, So I have, just thinking loud, three, short sentences. One, we need to think about one health, things which is WHO told us about the environment, which including climate change, is about the issue of animals and human being interact all together. All of us, we live on this planet. The second buzzword is about collective responsibility. Are we doing this in terms of protecting our environment in the era of major climate changes we are facing? That's really a big question. And the third one is the citizenship. It's about the responsibility of each of us, wherever we live and in whatever conditions. Actually, climate, the change in the environment and the climate change is very much depend on the economy of each of the Arab states. We are very much polluting the environment. We are actually destroying the environment in which we live. I see very little investment. I mean, Egypt, actually, just to name one of the countries, invested in preventing the expansion of desert in many, many projects. Saudi Arabia now actually expanding in areas of desert, building a new forest and agricultural land. But that is not enough, because the climate changes and the environmental changes doesn't respect any borders. There is no definition to the borders to these things. And it's in a society of consumerism, in a society which we don't know the public health measure in disposing our waste materials, the use of vehicles in such extensive way, the lack of changing or moving to electrification of our transportation from trains to cars to ships to airplanes, etc. All these things are measures which will affect our climate directly and indirectly. How the health system, which is your question in the last couple of minutes, should respond to the climate change? So unfortunately, our health system, and I say that with sadness, not in a negative way, that is designed for urgent and emergency care. Public health measures in terms of preventing diseases, is lacking in many countries, unfortunately. Some of the countries in the region are trying to increase their energies in terms of public health and what they need, etc. But that requires changes in our health system. With the climate changes we are seeing, and we're projecting that NCDs the burden of NCDs will increase from the figure of 20 to 40% now to something like 80% of the total death will be attributed to non-communicable diseases. How our health system is going to deal with that without investing in a prevention agenda? And that prevention agenda must start at birth and require huge investment. With the increase in the percentage of, this is the last minute, of elderly population in our population, we need to shape again the health system and the responses within the health system. Healthy elderly start at birth, and we must understand with this statement is really one can add a lot of health policies that shaping the health system of the future and make it much more resilient to what Professor Maha said, but most importantly, what is coming in terms of environmental issues and in terms of different population need associated with population growth. Thank you.
Thank you. Thank you very much, Dr. Salman. Thank you very much. Appreciate it. Very important and very fruitful information. So now moving to Professor Hiba and Professor Hiba Qadi, and with current situation, as we see, from one side, we have the crisis that we are witnessing everywhere. And from the other side, we are seeing the importance of the climate change that Dr. Salman was talking about in very strategic way. So how with current situation, how these overlapping crises affect people mental health? We are not talking enough about the mental health, especially in the conflict affected area, and unfortunately affected areas, in the region is one of the highest over the world. Over the past decade, how has the situation changed when it comes to depression and other mental health issues in the Arab world and Eastern Mediterranean region? What are the biggest gaps in mental health care? I see the mental health gap. It's first time I was exposed to the mental health from practical point of view It's when we have Syrian crisis. We discovered in Jordan that we do not have national statistics about the mental health. So we can imagine now, climate change, crisis, situation, poverty, discrepancies, different countries. So what about the mental health? Forgotten important topic in our discussion, even in our agendas, in the major events and in the major discussion. Please.
Okay.
Thank you.
The prevalence is really striking. It's really striking nowadays. For the climate change you've mentioned, for the disasters worldwide, displacement and dryness worldwide, exposure to violence in some countries, mostly mentioned Syria, Gaza, and Sudan, of course, and with the political instability and having to move from one country to another, changing your destination every now and then is not at all easy to take over. So there are conflicts, psychological conflicts, social conflicts, and with great issue of not having easy accessibility to mental health services, and even the ongoing stigma of mental health problems makes it, even if you want even to get access to such services, everyone around is still nagging and talking about the stigma of mental health. So the pressing gaps, indeed, I could even summarize in the insufficient integration of mental services in the primary health care settings, the lack of trained mental health professionals, the shortage of the culturally sensitive interventions, the observed stigma, as I previously mentioned, and lack of the robust funding and policy support for mental health programs. Whenever the programs are settled, the mental health is of least concern, even in the most developed countries, indeed. So if we ever improve the infrastructure of mental health and promote health education more, not just health education for how to prevent obesity and how to prevent the NCDs and how to prevent the so-called communicable even diseases, but about the mental health problems. And as you have mentioned, Professor Mohanad, these problems they start from the very young age. And as we have the transgenerational theories for mental health problems, once having been exposed to violence, for example, in the childhood, and you grow and you find yourself having this role, repetitive role, and you perpetuate the same maybe behavior. So we have, it's time to have these services properly integrated into the general health services. It's not just a matter of physical, for the complete definition of health, physical, mental, social well-being. So we have also to put into consideration the mental health. And I think this should always be done through training the primary healthcare providers for and routine and the role shifting. We're not just for having also always to be GPs and having to be internal medicine professional, but the mental health role has to be highlighted, incorporating it into the routine care and using simple tools, even of community-based approaches, technology. We use the telehealth and telepsychiatry. Telemedicine is of paramount importance. Even the digital portable tools for mental health assessment, screening for mental health problems is very important. And from the very start, if these are tackled and they are treated, it's really easy to control over building multidisciplinary team, and as I previously mentioned, the culturally sensitive services. As Professor Maha mentioned, all programs have to be tailored. The program that is fit for developed countries is not that for developing ones. The culture and sensitive issues that are openly tackled in the USA, for example, are not the same in our cultures. And we have to look deeply into these children in Gaza are really a robust upcoming generation with totally disastered, I mean, psychology. Yani they are going to be the future, but they are totally ruined inside. And of course, any program to have to be of success, it has to be monitored and evaluated ongoing, and surveillance system with screening tools, as I've mentioned. And to be successful, this should be carried out indeed. Thank you.
Thank you. Thank you very much. Thank you, Dr. Manal. Yes, and indeed. And we were suffering from mental health without these conflicts and wars,
Sure.
you know, and without genocides, you know. We can imagine what's going on in Gaza. We
Of
can.
course.
It's will be decades and decades, you know, to overcome these challenges that we when we were talking about the general population, we had something about this issue, and it was ignored. We can imagine now the effect of all these complicity and conflicts in the region. Moving, thank you very much.
Thank you.
And really, I have to admit that I thought my management of the time, I don't know, Dr. Nanda, how evaluate my management of the time. She has a lot of concern, but I think you are helping me a lot. So thank you very much for time management. Moving to our professor, and I consider Professor Abdul Latif as my mentor, and really he is my mentor. We met in American University of Beirut accidentally. I was coming as a research assistant, and Professor Abdul Latif was coming for his some work, and we met there. And both of us, we had academic NCD degrees. I'm coming from AUP with NCD stepwise. I'm coming from Glasgow University with cancer, and Professor Abdul Latif is pioneer in the non-communicable disease. It was in 2002. I am not wasting time, just I am trying to the disappointment sometimes and the difficulties that we are witnessing. So we spent 3 months together, and every day we were talking about NCD in the region, and we know how it's difficult to the region about non-communicable disease. And I know that I don't want to go back, you know, mental health part of NCD. This is not our discussion for today, but what we discovered later on, unfortunately, we woke up and we found that NCD on the bottom of the list of our public health priorities in the region. And this is very painful. There is no time for NCD. There is no tools. There is no money. There is no clear, you know, vision. It's maybe 15 years ago, but we faced, you know, crisis, wars. We communicable disease, you know, the largest outbreak happened in the over the history. It's in cholera, it's in Yemen. The largest outbreak in yellow fever in Sudan. The largest and wars and all these things. Cholera, you know, now all over the world, you know, the double of the countries affected by cholera is double. It was 16 last year. Today we have 36 countries affected by cholera. So unfortunately, NCD became not a priority. And maybe I am exaggerate or saying it in a very tough way, but 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 countries, when you are talking with them about about non-communicable disease, they are busy with other things. So, Professor Abdulatif, maybe you can tell us, of course, much more and a more strategic way about the painful of where we are from the strategy, where we are from the practice, where yesterday I was very ashamed, you know, seeing Jordan #1 over the world on smoking. Obesity, we have 6 out of 10 countries are in Arab region. So all statistics shows, you know, how much we are bad, you know, bad in terms of, I mean, statistics, etc. So it's very painful, you know, to see all these things and hypertension, etc. You know, and Iraq, you know, Iraq hypertension, one of the 5th countries over the world. Climate change, Iraq is there, one of the 10 countries. So all this in Arab world. So how do you think about? Let us focus on non-communicable disease. Please, Professor Abdulatif.
Thank you very much, Dr. Muhannad, for gathering us all together. And thank you for your initiative related to the state of public health in the Eastern Mediterranean region or in the Arab world, in my opinion. And as you know, Professor Maha, Professor Salman, Professor Hiba are very difficult people to follow on stage. They have covered a lot of important issues, and I'll do my best to give the due importance to non-communicable diseases. Just to start, in our Arab world, the NCDs are rapidly becoming the most important, in my opinion, public health issue in our world, especially in our region. This is combined with wars, internal conflicts, changing lifestyles, the aging of our populations, as you know, and urbanization. This is evidenced by the rising burden of non-communicable diseases, which in my opinion should be held at the forefront of our health priorities, surpassing, in my opinion, at least many of the classical health threats, but at the same time, not neglecting them. Whenever we think of NCDs, we think of death, morbidity, disability, etc., but also we should also think of the substantial health and economic burden. I'll try to be as short as possible, but in the Arab world, there are many efforts to combat NCDs, at least in the last 2 decades. You know, we have public health policies, we have many prevention initiatives, etc. But there are many implementation gaps. And I think this is a very important point to stress and think about. We have some lack of public awareness in some NCD-related issues, but very importantly also we have weaknesses in the health systems in many of our countries. And I appreciate what my colleagues said before, especially Professor Maha, that there are different contexts that we should think around and understand what is going on in every country, but also in the Arab world as a whole. To ensure an effective response, in my opinion, to the ever-increasing burden of non-communicable diseases, we need to put more emphasis on policy enforcement. We have, let me take Palestine as an example. We have managed to have ratified a public health law, an anti-smoking law, etc., but we have a very big problem in the implementation and in the policy enforcement. Access to care for NCDs is a very, very important problem in my opinion. For all countries, but especially for countries where there are wars, conflicts, and or under occupation, like my own country. And of course, we need always to emphasize the importance of multi-sectoral collaboration, because most of health happens outside the clinic and outside the hospital. If we manage to address these gaps, the Arab countries can really reduce this big burden, and this will help the Arab countries in their development and the well-being of our populations. So this is just a small introduction, but if we want really to go to the crux of the matter, in all of these suggested interventions, the political and socio-economic determinants of health should be stressed and addressed. War and political instability, which destroys life and health directly through casualties, deaths, and injuries, but also indirectly through displacement, starvation, weakening the health systems. In addition to inequity, large disparities in the socio-economic status, especially in many of our countries which has low or middle income countries, where poverty is a major determinant of health status and a major impediment in improving the health status. It means limited access to food, to healthcare, to other healthy living conditions, to proper housing, and this, of course, will lead to higher mortality and morbidity, etc., etc. Let me take a small angle and give you an example of what is going now on in Palestine and in Gaza. In the current war, which I think is a big attack on life itself, there is a systematic destruction of all systems, of all life components, of all public health constituents. I am saying that there are 6 Ds: death, disease, deprivation, destruction, demolition, displacement. All of these that we are facing from. These are real life challenges. We need to focus on interventions and policies to tackle the root causes of disease. This is a very important issue in my opinion, but also to do that, there is a precondition, which is stopping the external wars, internal conflicts. This will make us able to prioritize health in general and to prioritize effective health interventions. If I'm good with time, I can go on with specific details on each one of them, or I can stop here and give the opportunity for.
Thank you, Professor Abdulatif. If we will have time, we will go with second round of the question. But let us go first, and
Sure.
and then we can have more specific questions. And if you are interested, then we can give you the floor, of course, so clarify. Moving now to Dr. Faris. Now, I don't know what to say about Dr. Faris, but we spent last 20, 25 years, if you allow me to say 20, maybe 20, Dr. Faris, So working on the workforce development. And I think we work together in different places in building in-country workforce capacity. And this was, mainly field epidemiology training program that now we are very proud to say that we start in 2009 EMPHNET, and we had only 4 countries. These countries was in Saudi Arabia. It was established in 1998. 1988. Egypt, it was established 1993. And then Jordan, 1998. And then Pakistan, 2001. And after establishment of EMPHNET, we believed in the message of the message of the importance of building in-country workforce. So we are now having 16 countries, and we do not have anything the country have. The countries have their own programs, and we are very proud of supporting the countries with these workforce. Now, the question, of course, this is small aspects of the workforce that we are talking on. We are not saying that we are doing everything, but this is related to the public health in terms of linking the theory with the practice and on-job training, hands-on training, and we are very proud. Recently, I always feel ashamed about, not having this type of program in Palestine, but thankfully, we are working on that about this now, and many of Arab countries and non-Arab countries, Eastern Mediterranean. I know Pakistan, for example, they are very willing to support this program as much as we can, because we need to see the effect of the workforce on the ground, and we need to see, and we have lessons learned from COVID-19 when we saw that nobody can be deployed or nobody can be moved. So we need to build in country. And of course, in country, it's the main. So said that, Dr. Faris was, if you allow me to say Arabic word, if you allow me, Rafiq Silah for 25 years, and we did a lot in this terminal, in this aspects, and we established and we did a very good work to the region and to Arab countries and many things. But now, Dr. Faris, the question is how you feel about the brain drain that we see, the immigration of the workforce. You see, I remember I was in X country with Dr. Faris, and we found that all trained colleagues from X countries, they were important to the Y countries. So we said, instead of, building that countries that need, we start importing them. So what I am saying, now, UK, and of course, Dr. Salman Rawaf knows much better than me for sure. It's the whole health system is run by Iraqi, by the major, not all, but a significant proportion of the best Iraqi doctors. And what about the immigration? Why health immigration, public health immigration officers? What do you think, Dr. Faris? And how do you see this brain drain from our area to other areas? Please.
Thank you, Dr. Mohammed, and thank you for all the colleagues and the attendees for giving this opportunity. And first of all, I would like to acknowledge your great efforts in developing this report about the public health situation in the Middle East and North Africa. And also, I would like to admire the short video that you just presented, which showed, in addition to the great amount of information that you had, but also it clearly shows that how much diversity between the countries in the region, from countries in the GCC, which is something great, that they are doing robotic surgery and engagement of the AI in different aspects. Meanwhile, at the same time, we have surgeries for amputation, for example, without anesthesia in Gaza and other parts of the world, and in our region, and which also showed a lot of neglected crises like in Yemen, Sudan, and before that, Syria, Somalia, Iraq, and other countries. So all these, I think, these are among the drivers that led a lot of people, particularly health professionals, to leave this area and looking for some other places that they think that will have better opportunity for living and so on. Again, I think the HRH, human resources for health, as we all know, is part of any health system in the world, and raising their capacity is one of the integral part of the role of not only of the Ministry of Health, but all institutions engaged in the area of health. I would like to highlight the point that has been mentioned by Dr. Salman, that health is not the responsibility of the Ministry of Health. It is the responsibility of everybody. Everybody is responsible for health. In NGOs, others, they are all responsible. EMPHNET did a great job, really, in raising the capacity of field epidemiology, for example, in many other areas in the NCD and One Health and many other aspects. But again, this is only for public health, but what in other aspects. What I really want to highlight also in this area as part of the health system is the quality. We have to be concerned about the quality of the products of our health institutions. In many situations, and I think this is maybe related partially or completely sometimes related to the brain drain. The quality of the products, sometimes there is a question mark about them. In many countries, we are concerned about the quantity rather than on the quality. So in my country, for example, I can see the top-ranked graduates from the medical schools, from other institutions, health institutions, even before their recruitment to be members in the system, in the health system in their country, they are thinking, first of all, of how to pass the PLAB, how to pass the USMLE, how to pass other exam in order to leave. One of the statistics that had been mentioned by the Ministry of Health, for example, that almost 1/3 of the graduates in Iraq, they didn't go up for the first interview for assignment after the graduation. All of them had left the country, and the shocking figures that had been reported in your report, Dr. Mohanad, they are really shocking. That's in Tunisia, for example, the number of medical doctors who are migrated exceed the number who are graduated. I think 1,030 compared to only 1,000 that had been graduated from the 4 medical schools in the country. And the same is applied for Morocco, for Algeria, and it is not different from other countries in the region. This is a huge loss. Dr. Salman, correct me if I'm wrong. I think that the cost of graduating a medical doctors, for example, sometimes it can exceed £500,000, and to have a specialist, this can even reach to £7,500 pounds. So we are losing a lot. We are losing the brain, and we are losing a lot of resources that had been allocated for graduating those people. And instead of serving their communities, they go abroad because we didn't provide the adequate services in the country to keep them here inside the country. And this is one of the gaps that I think, Dr. Mohanad, we don't have a real system. Sometimes we have a lot of paperwork kept here or there, but we cannot implement them. In Iraq, once again, for example, a lot of problems because of lack of implementation of the laws. Every day, almost every day, there is a problem in many hospitals, and doctors have been accused, and doctors had been sometimes driven for tribal problems, and they have to pay tens of thousands of dollars sometimes in order to pass a problem, to the extent that it becomes just like a norm without any possibility of protecting those doctors from these conflicts and provide the proper services for them. I just few minutes ago, sorry.
Thank you very much, Dr. Faris. Sorry.
Sorry.
Okay. It's always my pleasure
apologies.
to listen, and colleagues, of course. So but I am under pressure, to be honest with you.
Okay. Thank you.
Ladies, when you put you under pressure, you have to obey you. Otherwise, you. So I move to my colleague, Dr. Nada Ahmed. I think She will get it back to me 5 minutes, 3 minutes, just to, and Dr. Nada will continue, facilitating the session. And for those who do not know Nada, Dr. Nada is one of the really believe in primary health care, and she was Director General in Sudan, and she is polio and immunization expert, and she's doing excellent job. And I always like to work with Dr. Nada. So Dr. Nada, please, the floor is yours, and it's your time to maintain the time, please.
Okay. Thank you, Dr. Mohammed. So now you are challenging me. So we have just a few minutes left, but I really appreciate having this distinguished guest and a respected international expert. And I just want to highlight in this and have some also reflection based on what reflected in the report, but also what we are going to share also as a short video on the example that EMPHNET tried to contribute for the region in adopting some context solution, considering the diversity in the region and the diversity and inequalities due to the different contexts that ongoing in the region. So we are just going to provide 2 minutes highlight on the response EMPHNET provided last year, complementing the report, and then we have few questions for the panelists. It will be like quick question and quick responses. So Amar, if you can just show the video.
Mm-hmm.
The region we serve is diverse. Different economies, different health systems, and different challenges. But one thing remains the same: the need for solutions that fit each country's reality. That's where EMPHNET comes in. In 2024, EMPHNET responded to workforce shortages by expanding field epidemiology training programs that emphasize skill-based learning. These programs equip health professionals to track outbreaks and drive rapid responses, with each cohort tailored to meet the specific needs of its country. We also strengthened rapid response teams, embedding them within national systems in Morocco, Egypt, Iraq, Pakistan, Tunisia, Jordan, and Saudi Arabia. Now, these teams are not just trained, they are operational, ready to act when emergencies occur. Especially in our region, where growing needs and limited resources challenge health systems, improving health must start at the community level. In response, EMPHNET has been working on the ground in Gaza, Sudan, Yemen, Afghanistan, Somalia, and Pakistan, training 1,500 community volunteers to promote immunization, maternal health, and disease prevention. These volunteers play a vital role, bringing health services directly to the people who need them most. Good decisions rely on good data. To make that a reality, EMPHNET focuses on research that leads to real-world solutions. In 2024, we prioritized addressing non-communicable disease management, primary healthcare, and maternal and child health issues that continue to need attention and actionable recommendations. Our focus was on turning research into action where it's needed most. No one can tackle our shared health challenges alone. For this reason, EMPHNET works across sectors and borders, training lab professionals in biorisk management, expanding One Health initiatives, and strengthening surveillance systems. The goal? A more connected, prepared, and resilient region in the face of common health threats. EMPHNET has always believed in solutions that suit the people they serve. Through strong partnerships with ministries of health, international organizations, and local teams, we are building a healthier future. Together, we're advancing context-based solutions for better health.
Thank Thank you. So this is just an example and highlight for the work EMPHNET is doing and exactly focusing on 2024, trying to contribute for the regional effort. So going back, and we are trying to link what's highlighted in the report, and we will be sharing the link for the report for the state of public health and also the report of EMPHNET work. Your Excellency, Prof. Maha, that in the region we are challenged on reaching progress in UHC, and considering now the context and the diversity in the countries in the region, and what we are trying to do, how can the regional country support this intra-regional collaboration to enhance health equity and to reduce this inequality through the regional entities and promoting this context solution that we are trying to adopt for the different contexts in the region. So if you can just have few reflections on that.
Well, thank you very much, Nada, and thank you very much for the great work last year and all through. And I just want to add one thing to your question, and it's about the health workforce. I'm sorry, Yani, but just to elaborate on something, that we need to really acknowledge the fact that there is significant progress in the global health. The needs are changing. The needs and demands are changing. So we have life expectancy is larger, reduced morbidities, mortalities. The needs are changes, but still we don't have this, the policies, the production and the retention policies are not there. So we're going to find that gaps are going to increase in certain regions, vis-a-vis increase in other regions. And this is due to, what is really being done to attract people. And that is why there is a code of practice that is being revised by, which is non-binding by the WHO for the international recruitment of health personnel, I mean. So we need to really revisit all of those things to put the health workforce development, retention, needs and demands into the focus and into the area. So for your question, and I think that now to ensure the resources are used strategically for universal health coverage, and given the fact that definitely we know that there are challenges, but there are opportunities for reform and transformation that is being done with different paces between the countries. But we have essential steps that could be used. We need to have the data-driven decision-making. We need to understand the health information system, the reliable data systems, everything, the needs assessment. It has to be properly underscored. And I would say, and I would put it even before the data-driven decision-making, the policy and the governance. We need to have this ensuring transparent and accountable, the management, healthcare management, with health policy alignment. And it was mentioned by one of the colleagues, if we have policies, but they are non-implementable, so the rule of the law and the rule of the policies, they need to be there. What is important is to have the equitable resource distribution, equitable resource allocation and distribution. We need to understand that we need to be targeting the vulnerable populations. So resources should be allocated to the most needy, the underserved, to the lower income communities, to rural areas. And this should be done in a way that would really make equity at a forefront of any policies or management. And for this, we need to have this efficient healthcare financing in order to, as we say, leave no one behind. We need to have the coverage financing schemes. And this has been implemented in some of the countries with success. What is there is to really think of how are we going to cover the vulnerables and the marginalized and whoever is in more need, the cost effectiveness, the funding mechanisms, and we need to have different funding mechanisms that would really complement and supplement each other in a way that would have reached this complementarity and the health workforce optimization. We know that there is discrepancy and disparities even within the countries, between the North and the South, not between the countries as a whole, but within the same country. And this planning is really important. We have to have sufficient numbers, sufficient specialties, sufficient training, and all of this has to be put into a policy and a strategy that is implementable, and not only for the time being, but for the future, given the changes that are being done. And again, it's the health system strengthening and resilience that we're talking about. Infrastructure investment, the quality of care, and the partnerships that we're talking about. We always say public-private partnerships, but in reality, we do not have this overall picture of this partnerships. We need to really define it. And of course, the preventive public health and for the early intervention. And innovation and technology.
Thank you, Prof. Maha. It's just, I'm really challenged by the time. And
okay.
yeah, so Professor Salman, you highlighted in your previous response about the impact of the climate change, the One Health, the intersectoral collaboration, and all these challenging things, which is not easily achieved in our context. But one of the issues that in the report highlighted is related to the antimicrobial resistance. And at EMPHNET, part of the response we tried to strengthen the surveillance, invest in the human resource, and try to do some promotion for this intersectoral and try to help the country to help build their system. What additional that we can do?
I think, well, thank you very much. Thank you very much. I'm glad that Professor Maha is very optimistic. I'm optimistic by nature, but I cannot be at this moment, actually.
Salman, please, not now. We can't afford it now.
Yeah, I know. I think one of the biggest problems we are encountering, I mean, the AMR is, as you mentioned, is a big issue. It's growing. WHO is taking it seriously. What is lacking, going back to the climate changes and environmental issues, is really organizations across the region that can coordinate the work, can lead on it. You know, WHO is extremely busy with emergency situations. There are many emergency situations we have within the region. And these situations are indeed worsening the status of health in many Arab countries. You know, people are suffering, not only in conflict zone, but people are suffering even in stable countries because of the cost of healthcare, because of the lack of access. We have to acknowledge that. We have to look at it from the perspective of people. The point which you raised, and this is linked to my third point and third pillar, you know, do we have institutions and doctors fit for purpose? I mean, the other day, a group of colleagues of high professionals in one Arab country shared with me a prescription of a 6-year-old child with asthma. 7 medications, two of these are antibiotics. Out of these 7, only one, as a pediatrician, indicated. The rest are unnecessary. And overprescribing is a major problem in our region, the African region and the Asian region. So that begs the question about the competencies and who will be responsible and take the lead in raising the standard of the quality which Faris referred to beautifully, you know, a quality of care provided to our population. And my last point, which is really important, international collaboration is very important. But I think, as Prof. Maha mentioned, is dented by the rich countries now, is actually reducing substantially. Some of them stopped it, even including my country, United Kingdom, you know, reduce the international aid by about 6 billion. United States reduced it by 60 billion. And there is a beautiful diagram showing every single rich country, including Japan, okay, have reduced and shifting. And this is the problem. Shifting these essential resources for vaccination, for tackling poverty, for building communities, for organization like EMPHNET and others, you know, shifting all these resources for more arms and more conflict. And we are at the receiving end of these conflicts. These monies instead coming to us to improve the health of the population in areas which are poor, where the poverty and the population are suffering. Now we are giving them more suffering through more conflict. And my prediction, unnecessarily prediction, stupid prediction, normally I don't do that, we will see more conflict, unfortunately, in our region. So we need to be aware of that.
Thank you, Prof. I know you, I was expecting that you would raise this. And I said, if you are not going to raise it, I will go directly and just question about, you know, this situation and the challenge that the health sector all is facing due to this reduction in the contribution growing day and day. One of the neglected area, Prof. Abdul Latif, and it's mentioned also in the chat question, there was a concern from the audience about the disability, and they are not. And with this conflict situation and what's going, this is again an more vulnerable population with this is growing in the region. So what can we do more to bring this on the top of the agenda and to draw the attention?
Yeah, I think this is a very important issue, and I have seen the chat that some people were alluding to it rightfully. It is extremely important to put it on the top of the agenda, but the problem is that we always go back to the, let me say, the distal determinants of health. This is very complex. There are many overarching factors influencing our interventions in the Arab world, from socioeconomic and political factors, political instability, environmental and cultural. We have too many challenges, but I think we should prioritize disability. Every day we are having new amputees, not only in Gaza, but also in other Arab countries, including Sudan. We have a large burden of disability in Syria, in Yemen also. And we need to put it at the top of the priority list and to tackle it and make it an integral part of any health policy that should be adopted by our countries. And we should also put enough emphasis on the role and the responsibility of the state, of the government, in tackling these issues and in providing resources to deal with them. At the same time, we need to address also the broader determinants, especially poverty, which has a real toll, especially on the more vulnerable and on the disabled. Thank you. I try to be as brief as possible.
No, thank you.
Running out of time.
Very helpful. Thank you. Prof. Hiba, in just maybe in 2 minutes, one of the area that EMPHNET is doing, and it's like highlighted at the gap also, is the continuous this learning effort and knowledge sharing and supporting each country to support each other, at least by sharing the experiences and best practices. Just few reflection on that and what can be done better to enhance this knowledge sharing in order to respond to this burning need in the region.
Of course, there is no more easy than sharing knowledge nowadays for the advancing technology and for, as we always say, all the world has become a small village. So linking together and sharing information between the different countries and sharing the expertise, opinions is really important. No one can ever start on his own and from the scratch, as we say, but we have to be multidisciplinary teams working together, sharing information, sharing data, and of course, the ongoing supervision of such data to check that they are accurate, that they are updated. Policies between the different countries should stress on such interconnections, and so that data are more easily shared and with no constrictions or constraints, I mean, for sharing such data. For the digitalization of every thing nowadays, and gaining access to such data is really easy. So this have to be stressed, and breaking all the limits between countries are really the only, and sharing even the research. One country is doing a very important survey, for example, on a global basis or scale, and every country has to share in such survey, and the results have to be spread and shared and to work upon for the upcoming research, of course.
Thank you, Prof. Hiba. I just one final question before handing to Dr. Muhannad, just to conclude. I think what also based on the short video, we showed that EMPHNET is trying to promote the community-driven models when it comes for the implementation and adaptation for context specific. And I was planning on also have some reflection from Dr. Faris on now this growing issues related to not only the mental health, but also the substance abuse. So how can we just link this approach with this emerging challenge in the region, especially in the countries which suffer this financial crisis and security issues and all these things. So just in brief, Dr. Faris, if you can reflect on that.
Thank you, Dr. Nada. I think it is this is very important, although I don't think there is enough time to respond to this question fully. But I think from the start, EMPHNET had tackled several areas that have been neglected before. One of these are, for example, the field epidemiology at that time, and you did a great job as EMPHNET, where it was clearly through the video where the expansion had been made. Also considering the recent problem and the emerging problem that we have, for example, the substance abuse, the mental health issues, and meanwhile we have the hospital-based oriented ministries of health with inadequate attention for the many public health problems that the countries and the poor people in these countries are facing. I think this will put more burden on the other NGOs, particularly an institution with such a heritage like EMPHNET, to do a great job in these emerging areas that need to be addressed. They are so important, meanwhile they are so neglected. So I think there should be somebody who should take the lead in order to move forward and make a change in the community. Otherwise, we will wait years and years and years till the other people in other organization or institution or ministries of health to respond adequately to that. We need somebody to be the promoter, to take the action, to be proactive in this arena, and not to wait for others in order to give us the instruction and then we follow. This is from my perspective, I think this is what we have to think about. Thank you.
Thank you, Dr. Faris. I think it's, for me, I enjoyed the discussion. I think it's a very short time to just get this ideas and experience from our distinguished, respected professors here in this event. I guess I will hand it to Dr. Muhannad just to conclude, because we are already exceeded the planned time for the webinar.
Thank you very much. And really, it's very, very exciting discussions. And I would like to highlight strategically the role of Infinite. Infinite is a platform, just platform, simple, you know. We are we are trying to bring the best in the region to be part of the region. You know, we have this culture. If you allow me just 2 minutes, I will be short. Nanda. Uh, we have we do not believe in ourselves. We have to believe in ourselves. No other choice. No other choice, colleagues. As you see the situation in the region, the situation in the globe, and the situation in at the national level. This is one. And I hope to be more specific about this. We start producing sub-specific discussions about this. This is a generic report, and we are very honored to have you co-author. I am talking to the panelists, you know, as to be co-author for these programs, and that movies will be translated into Arabic to reach every single public health professionals. Secondly, you know, I believe that we have to have this to move from webinar to something bigger by publication. This report, it will be distributed. This report, you know, it will be translated. These movies, it will be shared, disseminated. When you were talking, you know, I became, I do not want to be optimistic because I know the load of work, really. But for example, imagine if we have different we have public health now in general, and it's really something that I am proud of personally because we revised everything, and I hope you share the same thing. Now we are moving, for example, artificial intelligence. Why not? We are moving to climate change. We need, you know, to have a quarterly meeting like this and to have publication reports, etc. We need to move, you know. I know that emergency is taking time and etc. But I am against that. I am working also in emergency because I am leading. But I am against that we have to stop what we are doing. NCD special serial of NCD. We can produce our, what I am trying to say, we can start having our forum, Arabic forum. I am not replacing anyone, and I am not duplicating anyone. It will be very well studied, but I am saying we need to know about ourselves much more, much more. What's going on Gaza? No, it was not documented in a proper way. What's going on climate change? It's examples. It was not properly. Uh, 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 Nobody knows about the situation. Climate change is the effect of climate change is terrible. So we can together, you know, I think this is the platform where we can meet and to do the work. It's more work, but I think we can come up. And the beauty, I think the beauty, it's to not be biased to any of sides, you know, to not governments, to not WHO, to not USAID, to not to voices from the field, voices from academicians, voices from the experts. And this is, I think, very important message that I can go with the more very social determinants as Dr. Maha, Dr. Many Dr. Hiba mentioned social determinants. Where we are from the social determinants, public health, emergency, all these things. What I mean, artificial intelligence. Can you tell us where the word that we are reading hours and hours about artificial words, artificial intelligence, and we are behind? So let us having such discussion. And I am sure with the number of prisons, as I understood, it's more than 300, which is excellent start. You know, we had this in the past, but we can continue. And the quality is also important. We can do this. We are not aiming to anything except getting the public health one step forward instead of keeping talking about this same agenda, same projects, same issues. So it's a shame. It's a shame to not have something about because it's a shame. Sorry, Yani, I know that maybe some of the attendees will not be happy with what I am saying, but I will say that it's a shame. It's a shame to not write about Sudan and from public health point of view. I am talking about public health always. I am not talking about politics. Whereas we are as a scientist, as public health professionals, where we are, from all these things. And again, you know, this webinars or this issue was not in terms of selling this idea, but it came with the discussion when I have here what Dr. Abdul Latif saying. He is painful, is hurtful. So we need when we climate change, artificial intelligence was not there. Drugs everywhere. Do we agree that drugs everywhere in our houses, in our countries? Why we are not talking about this? So I hope it will be placed and it's for free, just efforts where scientists are coming and telling us where they are and to do recommendation. We do not know who's taking the recommendation, but it will be something that it's from different countries, like what we are doing now, different countries without any sensitivity. We are not interested in politics, but let us move forward. I think we can do much more in our region with the scientists, but we used to work at individual levels. It's hard. Maybe this is a time to work together in different countries. And maybe the next, for example, artificial intelligence topic, for example, maybe other scientists will be talking about this. So together, I think we keep improving our public health. And I think all of us, we have one objective or one goal is improving public health away from every other factors. Thank you very much. I am so sorry for taking more time. I am sure I always to the time, and I requested you to be to the time, but it seems the problem with mine, but it's fine. And this, as concrete results will be published, will be disseminated, will be articulated, will be translated. We need to see more after your approval, more steps to make sure that all these things are getting on the ground soon, inshallah, in different countries. Thank you very much, and appreciate the role of Nada. I have to tell that Nada is did excellent job, and she moved us from X to Y, and without her effort and her team, without her, the director is usually is doing nothing, except talking sometimes some few words. So thank you, Nada, very much. Appreciate
you.
all scientists, and thank you and I was really impressed by the number of registered people, more than 1,000 attended one third, which is excellent, and more. I am sure that and again we will publish this, and we need to contribute in supporting the current existing public health efforts. We are not competing, we are not repeating, we are not disseminating. However, we are strengthening our public health in Eastern Mediterranean region and Arab world. Thank you very much. It's a pleasure, colleagues. Have a nice evening. And we will not be very pushy. One every 3 months, it will be excellent. Thank you. Thank you.
Thank you. Thank you, Dr. Mani. Thank you.
Thank you very
Thank you.
much.
Thank you.
Thank you. Thank you. Thank you.
Thank you very much. Thank you.